This is Krista Michener. Welcome back to Made to Behold. Stay tuned. This episode, we're going to talk about cancer screening, cancer treatment, and how to be an informed patient. Made to Behold is intended for informational purposes only. It's not intended to replace the advice or care of a licensed healthcare professional. Participating in this podcast does not constitute a provider-patient relationship with Krista Michener, AHP Integrative Health, or any of the guests featured on Made to Behold. Krista Michener, AHP Integrative Health, and any featured guests aren't responsible for any losses, damages, or liabilities that may arise from use of information obtained in this podcast or associated materials. Please consult a healthcare professional for any health-related concerns that you are experiencing. So welcome to our episode on the big C, cancer. Scary word. I can't imagine there's anyone out there who doesn't know or is related to someone who has had cancer or has it themselves. I'm going to talk a little bit about screening and early detection. And a lot of this is going to come from a company called Galleri. If you go to Galleri, Galleri.com, this is a test that I'm going to talk about because it has really opened the door for early detection for cancer. So every cancer has its own DNA. So what the Galleri test does is just 2 tubes of blood, and it screens for 50 different types of cancers for the DNA of those cancers. Now, the ones it can't detect are anything in the brain because the blood-brain barrier prevents that from being shed to the rest of the system. It's enclosed. But the reason this is really, really exciting is outside of the Galleri testing, only 5 cancers have a recommended screening test. So we have our mammograms for breast cancer, our colonoscopies, or there is a Cologuard stool test that is a screening for colorectal cancer. We have prostate cancer. We have just what's called a PSA, a prostate-specific antigen. It's not really the most sensitive or best screening, but it picks up some things. We have lung cancer screenings, which are recommended for people who have been smokers. Usually you can get your health insurance company, if you have insurance, to pay for a low-dose CT scan. And then we have our pap smears for women to detect cervical cancer. So unfortunately, over 70% of cancers are other cancers, are not those 5. So we have standardized screenings for 5 different cancers, but then a whole host of them that there's not a way to check early. And unfortunately, most cancers don't have early symptoms, and they're often diagnosed later, which is really a negative for outcomes with treatment. So when cancer is caught early, before it has time to spread, so it hasn't metastasized at that point, it hasn't gone to any other organs, the overall 5-year survival rate is 4 times higher than a cancer that is detected in the later stages. And the sooner you know, obviously, the sooner you can act. So who should be screened? Well, obviously, the older you are, the more likely you are to get cancer, is what it comes down to. There are some where there's definite genetic risk, but age is the biggest risk factor for cancer. And you can start screening with this test, any time, but 50 is the recommended age because adults over 50 are 13 times more likely to have cancer compared to those under the age of 50. And one really scary statistic from the American Cancer Society is that more than 1 in 3 people will develop cancer during their lifetime. So regardless of your family history, the longer you live, the more at risk you are. Actually, statistically, per the National Institutes of Health, only 5 to 10% of cancers are inherited. So you do have certain types of breast cancer, not all breast cancers, some colon cancers, that there is a family genetic risk, but most cancers, there's no genetic risk. So again, 70% of cancer, there's not a recommended screening. And the last thing you want to do is just wait. just wait until something bad happens. But prior to this test, what are your options? Going and getting a full body scan every year is not practical. It's not affordable. You would be experiencing the risks with all of that unnecessary exposure to radiation. This test, I've been using it for a couple of years now, and I will tell you the vast majority of my patients come back negative. What it says is no cancer signal detected, or if you have a positive one, it says cancer signal detected. And so the patient that I'm thinking of who came back with a positive, it said cancer signal detective, and then the top predicted site of origin, so where it looked like it came from, was the lymphatic system. He did indeed and have lymphatic cancer, and we were able to get him immediately to the right specialist. I actually had my husband, Eric, do this for the first time this year. He had just been feeling generally tired and not well. His dad and two of his grandparents died of cancer in their early 60s, and I just said, I really don't want to mess around and wait and see where this shows up for you. So we did the test, and I'll tell you, I was really, really grateful because not long after we got these results back, which were negative, thankfully, he started having these weird other things. He had some chest pain with breathing, not feeling well. We did a chest x-ray, which showed that the left lower lobe of his lung was basically collapsed. And if you go through risk factors for that, he doesn't tick the risk factors. He's never been a smoker. He hasn't had recent chest or abdominal surgery. One of the few risk factors we hadn't ruled out was cancer or a tumor. But honestly, I felt so much more at peace than I would have, knowing, okay, we have to still keep digging, and we're waiting for some more test results today. But the fact that I had done this test, I felt much more at peace because I thought, okay, that means that there's a very low, low chance that it's cancer because of this. And of course, there aren't screening tests that are 100% accurate, but this has very high accuracy. They've done a lot of clinical studies. I personally feel that the reason it's not on a lot of insurances yet is just political, because I've become a cynic. It has really, really good data supporting its use. They did the research at major medical centers in the United States, but there's a lot of money to be made off of cancer treatment and cancer screenings, and I think that there is a lot of pushback from people because they wouldn't have as much business if we caught this early. And it's kind of crazy to me because even if all you care about is money, how much wealthier would our society be, and how much more money would we have in the economy circulating if people were healthy and able to work? A lot more. So is there anyone who shouldn't do it? Yeah, kids shouldn't do it, and I don't even think they will run it for minors. You shouldn't do it if you're getting cancer treatment. But we used it, like, for my mom who had breast cancer a few years ago, and she had her scan, but there's just this uncertainty. So like a year later, we did a Galleri screen and it came back negative. The thing that I find is amazing is that some of the things it can catch are cancers that are typically a death sentence, like pancreatic cancer. Most people do not find pancreatic cancer until it is spread, and the 5-year survival rate is very, very low. As I said, the results are really, really simple, and Galleri will reach out to your provider if it's a positive to help coordinate a referral if they don't have a system they're part of. But let me go through the list. I'll read it pretty quickly, but it's kind of amazing, the list of cancers that can be diagnosed after the cancer signal detected result, which is over 50. Adrenal, anal, appendix, bile duct, 3 different types, bladder, bone, breast, cervix, colorectal, esophageal. I know multiple people who have passed from esophageal cancer. None of them got an early diagnosis. Gallbladder, different types of GI tumors, kidney, larynx, leukemia, liver, lung, lymphoma, both types, melanoma, Merkel cell carcinoma, mesothelioma, nasal cavity, paranasal sinuses, neuroendocrine tumors of the appendix, neuroendocrine tumors of the colon and rectum, neuroendocrine tumors of the pancreas, oral cavity, oropharynx, the HPV-driven cancers, ovary, fallopian tube, pancreas, penis, plasma cell myeloma, prostate, small intestine, soft tissue sarcoma of the abdomen and thoracic, visceral organs, soft tissue sarcoma of the head and neck, soft tissue sarcoma of the retroperitoneum, soft tissue sarcoma of the trunk and extremities, soft tissue sarcoma of unusual histologies and sites, stomach, testes, ureter, uterus, vagina, and vulva. So that's a pretty extensive list, and I think it's just thrilling to think that we don't have to just hope that we don't get cancer, that we can do this and find out and have a better chance of catching things earlier and intervening earlier. The recommended frequency for the test, if you are able, is yearly. The cost of the test, if insurance doesn't pay, and unfortunately most insurances aren't picking it up, it's $949. However, they do a self-pay program where you can pay them over time, 12 months, same as cash, which I think works out to like $79 or something a month. So then the next thing to look about is what happens if you do have cancer, whether it's diagnosed early through one of your typical screenings or through this test. What do you do? Now, my first piece of advice would be to remain optimistic, because this is a much, much better time as far as treatment that's available, but also to really, really educate yourself. You need to not be afraid to ask questions. You need to not be afraid to be the squeaky wheel. If you're not comfortable with something that somebody tells you, then you need to be not afraid to get a second opinion or a third opinion and find people you're comfortable with. You know, my mom is a great example of this. She found her breast cancer. She had had a normal mammogram not long before that, but something felt off to her. I was there with her when they tried to convince her to only have a unilateral mastectomy, which is one breast removed, and she kept pushing back and said, absolutely not. I just care about being here for my grandchildren and my family. She had both breasts removed. They found it in the second breast. It was there. And if she wouldn't have pushed and gone with her gut, who knows what the outcome would have been. She drove over an hour and a half to her treatment because that's where she was comfortable. Those were the people she found that she trusted, and she was not going to take chances with her health. As far as what treatment you choose to undergo and what's recommended, these are the questions that I would ask. I would ask, what percentage of people recover with the recommended treatment? So, you know, some cancers require a combination of chemotherapy, radiation, surgery. There are some types of immunotherapy that are out. But I always question when somebody says, well, we're going to do the surgery and chemo and radiation because we have to do everything. We have to give it our all. Sometimes that's indicated. There are some cancers that respond very, very well to chemotherapy, but some cancers don't. So I would really recommend starting with asking your provider, okay, statistically, what are my chances of getting well if I do this treatment? And what are my chances of getting well if not? And what are the potential side effects of treatment? You know, if you have tongue cancer and they're going to recommend cutting out part of your tongue and doing radiation and chemo, and you have a 10% survival rate, I would strongly recommend not doing it because your quality of life is going to be garbage. You're not going to be able to eat. You're not going to be able to talk. You're going to be in horrible pain. Those are good rates. I don't think that's worth the risk. And there are things you can do to support your immune system, even if you decide not to treat, that can improve your outcome. We had a cancer patient come in who we started on just two things, N-acetylcysteine and then a form of bonded cysteine called Immunical to help with detoxification while we were waiting for her other labs and she was going through cancer treatment. I always recommend that. I don't suggest turning to your natural provider or holistic provider as an alternative to cancer treatment most of the time. You'd really need to find someone who's willing to work with you on the best of both worlds. But in just a week of taking those two things I had recommended, her white blood cell count had completely normalized and it had been tanked by treatment. And she went in and they said, "Oh, what did you do?" And she told them. They said, "That's great. That's what you should do." And I'm thinking, then why didn't you tell her to do it? Why was I the one recommending this? You do have to ask your oncologist if you have a treating provider. I would ask questions too about what they are willing to let you do outside of their care. So I have a friend who has worked in oncology for years. She said she sees about a 50-50 split with oncologists. About half of them want to have the final word over every aspect of your care. You only take the medications, supplements, everything that they prescribe. They're not open to doing any outside things. And then she said about 50%, usually the younger ones, are open if you want to add nutrient therapy or other things like that, are a little more open-minded and will give you freedom to explore those things. But I always recommend having providers that you're working with who are respectful of the other disciplines and are willing to work together. So, if I had a patient come in here who had cancer and they wanted to do IV nutrients, for example, I would just say, well, let's do testing. Let's see what we recommend. And then let's get your oncologist to sign off on this to make sure they're comfortable with everything that we're doing. So there are things you can do to support your body during treatment. A lot of our Amish patients in this area actually go to Mexico for treatment. And the reasoning that I've heard is fairly sound. It makes sense. They say, when you get treated here in America, all they do is tear the body down, and we want to go somewhere where they're building it up too. And so what they include in treatment there is hyperthermia, heat therapy, where you're actually put to sleep and they raise your body temperature quite high. They do IV nutrients. They do a lot with diet, nutrition, and detoxification pathways. My dream for this country is that people wouldn't have to leave the country to get that type of coordinated care, because I've seen some people do well with that, especially if they're early stage, but I just don't think it's the best option for cancer that's late stage, because you need someone close to home who has an eye on you, who's monitoring you, who can do physical exams and order labs and do appropriate follow-up, and you just can't do that from another country logistically or legally. So the sorts of things that you can do on your own are optimizing nutrition, doing things that optimize detoxification. One of those things is a sauna, if you have consent to use a sauna for brief periods of time from your oncologist. Raising your body temperature stimulates the immune system. There are a lot of interesting anecdotal stories about areas that became more afflicted with cancers after the swamps were cleared and there was no more malaria, so there weren't annual fevers, basically, that the fever produced by the malaria was protective against cancer. It's kind of an interesting thing. So there are a lot of things that you can do, but it's going to rely on you and hopefully a family member, a friend who's on your team to advocate, to not be afraid to ask questions. It's a really tricky balance, I think, that we all face between wanting to find people to work with that we trust, because you should trust your providers. If you've got someone treating your cancer, you want to feel like you can trust their decisions and their opinion, but then at the same time not being afraid to question things, but doing it in a respectful manner. I think the ideal is not to find a provider who knows everything, because that person doesn't exist, but to find someone who's educated and who's open-minded and who isn't threatened by your questions, who's open to what's going to make you comfortable and willing to think outside the box, I had a patient years ago who unfortunately died of breast cancer. And, she said she knew for a year, but she was just too afraid to go in. And time is life. Time is life. Delaying diagnosis and treatment by months or especially a year is going to be a real negative, not just for whether or not you live, but for your quality of life. If you have questions about cancer and cancer treatment, I'm not an oncologist. I do not treat cancer. But if you have any questions about resources or things you could use to augment your treatment, feel free to shoot it to the podcast line, and we'll certainly dig in, try to find some people to help us. But what your goal should be is really the pillars of healing. So, the first I being the illness, obviously you have to treat the cancer. But as far as enduring treatment, you want to be doing things to reduce inflammation because that's going to help, obviously, with your comfort level, with pain, and boosting the immune system. And a lot of that's the nutrition, the rest, but definitely in the circumstance of cancer, you want to be optimizing nutrient intake, but you want to do that in a balanced, safe way. I think it would be a great investment to do some good micronutrient testing so that you are making educated decisions about what you're putting into your body, and recognizing that when the treatment's over, you can do a lot more with rebuilding, but during treatment, you're just trying to support the body because the cancer treatment isn't just destroying cancer cells, it's destroying healthy cells too. So trying to mitigate the risk and the damage, and then being in the frame of mind that when you're finished with treatment, there's a lot of rebuilding to do, you'll be okay. So if you have questions about the Galleri test, go to galleri.com. You can request the test, and what you do, it has to be through a provider. It has to be prescription. But if you go to request the test on their website, there is a discussion guide. It's an amazing advancement. We're always learning more, and I'm excited to be alive at this time where we have less invasive, more affordable options for cancer screening. $949 is a lot of money, but in the context of what you would pay for all of these other screenings that could maybe catch 5 different cancers, you're investing in something that could catch 50, could catch them early, and could really help. So feel free to reach out to me if you have questions. Feel free to go on to Galleri's website. I know they're always happy to answer. And remember to always have hope, because you were made to be whole. Have a podcast question or suggestion? Text or call us on the podcast info line at 330-439-0686. Thank you for spending time with me today. If you like what you hear, please subscribe to be notified when new episodes release. And remember, you were made to be whole.